As representatives of the people, isn't it our first and foremost task to protect the fundamental rights of the people who elected us, regardless of our political affiliation? To reject proposals that infringe on their personal freedoms and their bodily integrity. We have received thousands of messages from concerned citizens asking us to protect their fundamental rights and to vote against the COVID certificate. What kind of parliament are we when we rush to introduce measures that link medical status with the enjoyment of civil liberties?
Certificates are not travel documents, they are not passports, they are simply a certificate that facilitates the free movements for our citizens. If you're not yet vaccinated, you can still travel showing your negative test.
Extremely worrying. This has nothing to do with European values or civic freedoms. The Green Passport does not provide more freedom. The Green Certificate gives more control.
Here's how it works. With Health Passport Ireland, everyone can now be tested for COVID-19 at any time. Your COVID-19 test will be performed with highly accurate serological or swab tests. Your test is performed by a medical professional. Your COVID-19 status will efficiently display as green, amber or red, dependent on your test results. We can all use Health Passport Ireland in many ways, such as travel, hospitality, education, healthcare, construction, offices, entertainment,
visits and much, much more.
A company that previously only been known for event management and organising festivals in the Middle East. It had a residential apartment address in Dublin city centre and had one employee who was the owner of the company, Robert Quirk. We know that a subsidiary of that company, another RockU company, went on to do the testing in Roscommon and also was involved in developing the Health Passport app. So you just wonder how these contracts are awarded for a company that has no history or apparently no expertise in the health products area.
Will be demonstrating a new approach to COVID-19 digital passport. The Health Passport Ireland has been designed to do two things. So one is to stop the continued spread of COVID-19 by introducing increased screening measures. And number two is designed to help protect our economy by having to keep businesses open. So this is a common platform for all businesses to use across multiple industries.
The Government recognises the importance of the Digital Green Certificate regulation in supporting the lifting of restrictions currently in place in a coordinated manner and facilitating that fundamental right which I refer to of people in the EU to move and reside freely within the EU.
EU countries, including Ireland, are currently developing their domestic software for the digital green certificates in tandem with the legislation being negotiated at European level.
There are two strands to Ireland's stated and reported plans for vaccinated type certificates which need to be considered. The first one is the EU COVID-19 certificate and domestic vaccine passport system. Ireland is not a paper-carrying country, and nor, in my considered view, should we ever become one. On a cautionary note, we don't want to see the introduction of any type of health passport, health database or ID card by stealth. When a new power or technology or something like this is introduced, there is almost always function creep. History tells us to be careful about sleepwalking into a situation where we label some people as being clean and others as unclean or potential vectors of disease. By the end of June, I understand the government target is to have over 80% of the population vaccinated with at least one dose. So virtually everyone at risk will either be vaccinated or had vaccines offered to them. Effectively, we would have reached the point of herd immunity. I wonder to what extent is private enterprise involved in the Digital Green Certificate programme.
A coalition of health and technology leaders just announced an initiative to accelerate digital access to that information.
But big tech and healthcare IT firms are launching a vaccine credential initiative today to create a uniform standard for secure proof of vaccination.
What we're going to create is a global registry, effectively, of what are the trusted sites in your countries that are doing COVID-19 lab testing for the purpose of foreign travel, and eventually, of course, administering vaccines. What we actually want those lab and vaccination sites is basically collect identifying information.
Dieses gelbe Dokument, das ist der internationale Impfpass der WHO. Und nachdem ich ein Vielreisender bin, habe ich den immer bei mir. Da ist jede Impfung genau dokumentiert. Datum, Arzt, Impfcharge.
In fact, there is no obligation on the DPC under the 2018 Act to produce a decision in the case of any complaint.
I want you to consider this sobering statistic. In the 3 years since the GDPR was applied, the Data Protection Commission has asserted its lead role in 196 cases. But it has delivered decisions, even draft decisions, in only 4.
The rationale of companies is risk-based. They are basically thinking, if it costs me €1 million to comply with the GDPR, but there is no realistic scenario that I'm going to get a penalty, then it's business sense that you don't really comply with the GDPR.